Delhi's air today isn't just polluted, it's poisonous. Toxic levels rising, AQI and worsening health, yet little seems to change year after year. The apathy is thick in the air too. While the city gasps, the Chief Minister has been busy campaigning in Bihar. Government officers have revised timings. But what about everyone else who lives in Delhi? The children walking to school in the smog, the elderly struggling to breathe. Some families are now making life-changing decisions, leaving Delhi altogether, not for better jobs or schools, but simply for what is their right, cleaner air. That's what it's come to, folks. And here's the shocking truth. Not all AQI monitors are even working. We don't really know how bad it is out there. This isn't seasonal smog anymore. It's a full-blown health crisis. And the question that must be asked this afternoon is simple. Who's really taking responsibility while Delhi chokes? What about all the stakeholders? Can you stop blaming each other? Can the Aam Aadmi Party stop blaming the BJP? Can the BJP stop blaming the Aam Aadmi Party? We're all living here, millions of people, and we're gasping for fresh air, which is the right of every citizen. Joining me live at this point is Dr. Naresh Trehan, Chairman and MD of Medanta. Dr. Trehan, thank you for joining me here on Breaking Ground. The latest Lancet Planetary Health study, Doctor, links air pollution to nearly 11.5% of annual deaths in Delhi, a staggering figure. From a medical point of view, from a doctor's point of view, do you see this as a public health emergency?
Of course it is. It has been like that every year, and it's getting worse. So the question is that we are aware of it, that it's going to happen. We are aware of it, that it's going to take many, many, many lives. If we are aware of it, that it's going to make many more people sick. The hospitals are full of patients with asthma, with pneumonia, so you name it. It is devastating, the effects of the kind of pollution or the level of pollution we have in a place like Delhi and some of the other cities also, that this is a huge toll on the human element of our people. So I think that, if you can sense the urgency in my voice, I mean, we cannot let this continue because we have to actually protect our human beings, our population. And why are we adding to their illness by not controlling it? Now, controlling it is another factor. We know that these 2-3 months are going to be like a gas chamber for us. We know the constituents, that high level of pollution, especially the particulate matter, the noxious gases. So we know the elements. It's all been
all right.
now.
But Dr. Trehan, if I could come to my second question, a follow-up question here. We're hearing of rising cases of respiratory distress, chronic cough and eye irritation, even among children, Doctor. What are you seeing at Medanta right now? Are hospital admissions rising there?
Yes, at least 3 times more. The number of patients who are visiting the outpatient department, it's gone up 3 to 4 times. The number of admissions has increased in the respiratory space, like pneumonia, asthma, precipitation of asthma. People actually, having very difficult time breathing, and their PO2s are dropping. So there is a huge toll the public is paying for all this, and especially the elderly people.
Yes.
And the other part, which is very important, is that it is even affecting our children, because our children's lungs are getting affected and their neurological development is getting affected by the noxious gases. So all around, it is a public emergency. We should introduce all the measures we can right away to try to stop it. All construction sites must have the misting machines prescribed by the Environment Ministry, so that the dust does not fly. Even if you have to stop construction for a little while, so be it. Whether there are many ways of keeping the vehicles off the street, you can do the carpooling, you can do alternate day cars with odd and even numbers. There are many things
Yes.
we should do, but I don't know why there is not such a reaction from around us that we have the pollution level is breaching 500.
Which brings me to a very important question, doctor. Are you seeing long-term irreversible damage among younger patients, those who have grown up breathing Delhi's air, doctor?
Absolutely. These kids will have a high propensity for developing asthma, sensitive lungs, choked lungs. I've shown it that the lungs of people who live in Delhi and the ones who live in the mountains, there is a difference between black and pink. So all this is happening to our children. Our children are going to be the biggest victims. And what is worse is that it's not getting any better. Every year it's the same or worse.
Doctor, many parents are now contemplating leaving Delhi for their child's health, for their children's health. As a doctor, would you say that's justified given what we're seeing around us, the air we're breathing?
Of course, if it's going to happen and year on year, if you have the ability or you have the option of leaving town, yes, maybe for these 2-3 months one should leave town. But this cannot go on forever. I would like to know any problem. We can go to the moon. Is it such a complicated problem? We just have to have the will to do it.
Do it, not the politics over it, is what you're saying there, doctor. For a moment, if you can just cast aside the hat that you don as a doctor and put on the hat of a citizen. You've lived for decades in Delhi, doctor. Are you frustrated today as a citizen of Delhi?
Yeah, but this is what it is frustrating. Not only frustrating, it is now creating a great amount of anxiety in people. And anxiety in us also, because it affects everybody, including me. Now, the question basically remains that how are we going to tackle it? But is there enough thought process around in all the agencies and all of us to come together to say, how can we fight it? It is a collective responsibility to fight it. And I don't think that if the government alone can fight it, I don't think people alone can fight it. It has got to be a issue where we all can be brought together, and I think every citizen will be very happy to participate and do what they can do to make it a livable city.